Such an interesting study. As I said, the provincial health officers and a number of municipalities as well joining together, calling for change to the way this country tackles drug policy. What scientific evidence is there, Dr. Karl, at the heart of their call for Canada to reform its practices?
Well, at the heart of this is basically the idea that, according to research, criminalizing and cracking down on people who have issues with addictions is not effective when you compare it with things like harm reduction approaches, expanding treatment options for people dealing with addictions, and so on. So it's really about shifting the focus from criminalization to a medical model or a harm reduction model of dealing with addiction.
And we know, of course, you work in the addiction field. So what is that recommended? How effective is that type of health-based focus in terms of dealing with addicts?
Well, we know that it basically is the most effective way. So when somebody is dealing with addiction, there are a number of issues around that need to be addressed. And sometimes it might be underlying mental illness that needs to be treated. Sometimes there are social factors. It's sort of looking at the whole person and the dynamics of that person, as opposed to stigmatizing and punishing somebody who's dealing with what we now consider to be a disease.
But if you use it as a health model, if you treat it using that health model you've outlined instead of a criminal justice system, how much of an extra burden would that place on the healthcare system?
Well, there's no doubt that at this point there are insufficient resources to deal with addictions broadly in Canada. And we saw that in some of the northern communities around the time that OxyContin is being phased out, for example. We need to invest more into sort of addiction services and mental health services. But what these physicians are arguing is that in the broader sense, when you look across the society, the costs of incarcerating people for long periods of time, mandatory sentencing, etc., will outweigh the costs of trying to help people and rehabilitate them and get them back to being productive members of society.
Interesting, because what you just outlined at the end, though, that tough on crime stance and the mandatory sentences, that's just been enshrined in legislation under the federal government, of course, in its tough on crime agenda. So it seems like there's not a change coming as far as that goes, but I'm wondering if you can get a read on public support for a health-based policy.
Well, according to this study, about 50% of Canadians would support legalizing something like marijuana, for example. And the opportunity that would afford, and it's certainly something that's not palatable to all Canadians, but what it would do is offer the opportunity to control the use of these drugs like marijuana in a similar way to the way we control alcohol and tobacco.
Dr. Karl, good to hear from you on this, particularly given your background in the field. I appreciate it. Dr. Karl, our medical specialist on our top story today.